My name is Maria Fernanda Rodriguez, and my testimony before Congress is going to be about mandatory palliative care consultations for terminal diagnoses and why I believe that this is a very important issue that we need to address. While dying is part of the cycle of life and eventually all of us will experience it, it is something that will come naturally. Death is often treated as an illness. As a consequence, many people die in hospitals in pain and alone. Palliative care focuses primarily on anticipating, preventing, diagnosing, and treating symptoms experienced by patients with serious or life-threatening illnesses, and on helping patients and their families make medically important decisions. When a human finds out that they're entering the last stage of their life and the end is near, there is no correct way to process it, especially if you're going through a very difficult disease. Palliative care specialists help patients and their families establish the need for a medical proxy, advance directives, and resuscitation status. To understand why mandatory palliative care consultations are very important and why I'm advocating in this position, we need to understand the policy on federal level. Current policy on the federal level does not mandate palliative care consultations for terminal diagnosis. Palliative care is at the physician's discretion and based on referrals. There is, however, a greater focus on hospice care on the federal level, where you can get coverage through Medicare if your life expectancy is 6 months or less. The terms palliative care and hospice care are sometimes used interchangeably. It is important to distinguish that although hospice provides palliative care is not hospice. In hospice, the patient is expected to live 6 months or less, and it focuses on providing comfort rather than curing the illness. Palliative care, on the other end, focuses on providing comfort and improving overall well-being of the patient. Between 2019 and 2022, 17 states enacted legislation or allocated budgetary funds to support and expand palliative care initiatives for older adults. But neither at the state nor federal level do they have a consistent policy that recognizes the importance of palliative care to patients' lives, sometimes leaving palliative care out of the picture and creating more gaps and poorer health outcomes. The American Medical Association House of Delegates has stated regarding palliative care, physicians have clinical, ethical responsibilities to address the pain and suffering occasioned by illness and injury and to respect their patients as whole persons. When we think about a sensitive topic such as the end of life and the aging population, we have to think ethically about the problem. So that is why one of my arguments is the 4 principles of healthcare ethics because it helps to paint a bigger picture when dealing with serious issues that can affect the patient's well-being. The 4 principles of healthcare ethics are autonomy, beneficence, justice, and non-maleficence. In this case, starting with autonomy, as stated before, the physician has an ethical responsibility to respect their patient's autonomy as a whole person. By giving them the autonomy and the agency to make their own decisions, this will come from an informed place where they can seek palliative care and they can see it as an option. Beneficence is also providing palliative care that helps patients suffering from chronic illnesses. As we mentioned before, palliative care focus is on improving the healthcare outcomes of the patients. By doing this, it is a form of fairness and justice because the patient is receiving the help that they need and also the release of some burden that they otherwise might have, by having a sense of what is going to happen once they're gone, their advance directives, the resuscitation status. This is overall is going to improve the health of the patient and of their family. As I mentioned before, there is no current policy on the federal level that mandates palliative care consultations for terminal diagnosis. That is why my policy proposal is a policy focused on mandatory palliative care for terminal diagnosis that will help address the ethical concerns outlined above by ensuring that all patients receive comprehensive and patient-centered care at the end of life. It will also touch on the 4 ethical concepts because it will promote justice and dignity for the patient. One of the main things that you will hear from people at the end of life is that they want to die with dignity. So this proposal will bring them the justice and the dignity they deserve. It will help with their suffering, and it will improve their mental health, and also will improve the mental health of their families. So when the time comes, they feel they die the way that they wanted. They feel they have the autonomy, the fairness, the beneficence, and the dignity that they deserve. These are my references, and thank you so much.